minute or so. And just wanted to welcome you all again to another in our series of webinars that follows the pulse surveys that we do monthly at Root Cause Coalition. Those of you who are members or who have been following us for a while know that at the end of the year, we take these reports and roll them up into a summary report on all the different topics. Today, though, I'm really excited, although it's a very serious topic. I think that there's some really compelling research, and I'm glad that we are able to be joined by one of our members of the Root Cause Coalition who has partnered with us on this research. If you joined these before, you know that Alex Lewins-Wordling, who is our senior advisor for research, will be presenting a lot of the data. But if you'll allow me to take a few moments to introduce Melissa Fox and what she and her organization does at Ascenda Health, be delighted to take some time to recognize you, Melissa, because your work is just so powerful and so important. So Melissa is the Chief Operating Officer at Ascenda Integrated Health. She oversees the operations for more than 100 programs throughout 12 counties in New Jersey, with services that include evidence-based programming in child welfare, prevention, juvenile justice, outpatient mental health, crisis services, substance use disorder treatment, and supportive housing. Melissa has had a distinguished career of more than 20 years leading innovations in healthcare operations, including federally qualified health centers, healthcare for the homeless, behavioral health, home care, and hospice. She's been featured in numerous publications and is an expert speaker for her work within diverse healthcare environments, as well as addressing the importance of data in driving innovations within the healthcare setting. Melissa is a member of the American College of Healthcare Executives, the National Association of Health Services Executives, and the Medical Group Management Association. She has served as an expert speaker for organizations including the National Healthcare for the Homeless Council, National Nursing Centers Consortium, Philadelphia Social Innovations Journal, Open Minds, and the Health Center and Public Housing. Tireless in her dedication to serving the needs of others, she is also a board member of the Metropolitan Area Neighborhood Nutrition Alliance, known as MANA, Camden Coalition of Healthcare Providers, the Urban Affairs Coalition, the National Wellness Institute, the Gloucester County NAAP, and the Root Cause Coalition. Melissa, we are truly so grateful to you and all of your colleagues at Ascenda for not only being part of the coalition, but the work you do every day on behalf of so many. We're looking forward to hearing more about Ascenda and its work, and then we'll also go into the research slides as well. If you all don't mind keeping yourself muted throughout, we will have time for Q&A at the end, and I would encourage you to just introduce yourself in the chat if you have a moment to do that, and then I'll close things out at the end of the hour as well. But right now, I'd like to hand. Thanks so much.
Thank you so much, Barb. And thank you to the Root Cause Coalition for having me here today to talk about this extremely important topic. I'm looking forward to some really good, robust discussion as we get into this data. I think you'll find it as fascinating as we did. So I'm going to take a little bit of time to talk to you about Ascenda, why this was important to us as an agency, and why it should be an important part of any conversation that any of us are having, regardless of where you're entering the healthcare realm, that, you know, we really should be looking at how this topic, how this epidemic is affecting our communities and their health. So I'm going to share my screen. Give me a moment to get set up here. And I believe that you all can see this now. If everybody can give me a thumbs up, who can see me? Let's get this started here. Okay, so as this first slide here says, where Ascenda is focused is partnering for community health. And so even though, as Barb mentioned, we provide over 100 programs across multiple counties in New Jersey, we always understand that it's not just about Ascenda. It's about how we can partner with the right people who are committed, who have the tools, who have the resources, and who have the heart that we do to change our communities for the better. So partnering for community health, and that partnership is extremely important to us, and it's something that we infuse into everything that we do. So as you heard Barb mention again, we across 12 counties, we're very proud to be able to provide the services that we do. We recognize that it's a huge mission, it's a huge, important burden that we carry in making sure that the services that we're administering across these counties to the most vulnerable are thoughtful of the needs of the families and individuals we're supporting. This isn't something we enter into lightly, and it shouldn't be. Right now, healthcare is more important than ever because of the multi levels of issues and concerns that our communities are dealing with. So we enter into that, and especially when we're coming into people's homes, we know that we're coming in at their most vulnerable sometimes, or many times. So we do approach it with that thinking. So everything we provide, from prevention to substance use disorder treatment to crisis services, it all starts from that initial heart of concern and compassion, and it really does carry throughout what we do. I'm so proud, Barbara, and I gotta tell you, I'm so proud of our teams, and I know everybody says that, but it's really, really true at Ascenda. Because from the program leadership to our marketing team, I see Jim Curtin, he's on the line. He's my partner here with moving some of these initiatives forward from a government advocacy level. I mean, we're all working as a team to make sure that everything is happening the way that it should. And so when you look at these programs and look at what we do at Ascenda, and I encourage you to go to our website if you want to learn a little bit more about the programs we provide, one could ask, why is it important for an agency like Ascenda to be involved in some conversations or research about gun violence? What is it that you're doing? Are you doing, gun violence intervention programming? Or are you involved in the acute care setting somehow, where you see the gun violence victims? And here's what I say to that. I say what I said at the beginning, that all of us have a part in making sure that this is addressed, because gun violence is not just about the incident itself. The gun violence incidents, and we're talking gun violence, it includes suicides, it's including homicides, it's including the folks who survive the incident but carry the trauma. That manifests itself, and the effects of those situations manifest themselves in many ways. They manifest themselves within communities economically. They manifest themselves within communities, from a physical health standpoint. They manifest themselves from people being able to maintain their jobs and go to work. So it does have an effect on everything that we do. And for Ascenda, with the programs that we provide, we're seeing these impacts every day. No, we're not in the hospital. No, we're not taking care of people who have been shot directly, who've been impacted by those incidents directly, but we are dealing with them directly in terms of their traumas, in terms of seeing them not being able to maintain in different ways. So we all have a part in that. And we wanted to understand a little bit more, not only what are we seeing in New Jersey, not only what's happening in New Jersey, but overall, how does the nation feel about this? And how does this vary and differ depending on where you are? So these are just a few things that I think it's important for us to remember when we're talking about impacts. So in New Jersey, of course, there's some very direct impacts. And you look here at some of the cities, some of the top cities. These are cities that account for only 10% of the state's population, but the majority of the fatal and non-fatal shootings in 2021. That's significant. So when we're looking at this, we're understanding that there are some communities that are impacted more than others. And when you're supporting some of the most vulnerable, some of the most marginalized communities that have historically and systemically been prevented or have experienced barriers to getting to certain types of cares and supports, if you layer gun violence incidents on top of that, you really do have a powder keg there going on. So we are understanding that when we're operating within this space and we're providing the services that we do, especially within our own state, that there's a high level of need. The second bullet here, in terms of what's being affected by gun violence, I won't go back into that, but this is well known, well stated, well researched, that it is not just the incident itself. It's the after effects of the incident, it's the pre-incident, and the community and the setting that it exists in, but it really does have a really embedded effect in our community. And I mentioned here that the societal conditions that exist in the communities that are affected largely by gun violence are some of the same ones where we've seen the exacerbation of COVID-19, where we've seen issues with accessing healthcare, we've seen many economic disparities. It's the same community. So how can we help? How can we be there to support them? The significant economic impacts I've touched on, and this is something that we all need to be mindful of, but all of these points here and more are really indicative of why Ascenda, it was so important to Ascenda to understand a little bit more and partner with the Root Cause Coalition to really get more understanding of how this is impacting our communities and how our communities are viewing gun violence, which is important as you're building interventions. And one of the other things that we're doing, excuse me, that was important is we've recently started our Ascenda Institute of Health Innovation. And what the Ascenda Institute of Health Innovation is allowing us to do is to almost step outside of our comfort zone, you know, as a provider, and really start to push the envelope, create settings where we can have these dynamic and interesting conversations about, so what comes next? This is what we typically do. This is what the expectation, but how do we now go to where the problem is going? How do we create solutions and innovative partnerships that allow us to support our communities in the way that they need, not just today, but in tomorrow as well? So the AIHI allows us to do that and really bring together some interesting thought leaders, have these uncomfortable conversations in some cases, push the envelope and create a setting that will allow us to not just talk about it, but be about it and create solutions that we can then measure and move forward and change outcomes the way that they need to for our communities. So there's some content that we provide on the site and some really interesting articles, some trainings for anyone who wants to become a member of the Institute. You just go into the website, Ascenda Institute. .org. And if I mess that up, Mary's going to kill me, but Mary, drop it into the chat if I said it wrong. But we have some really great static content that's there that organizations can consume. We also look for other organizations to add content. But again, it has to be something that's going to push the envelope. What's the next level? What's the next stage? How should we be partnering? So there's some static content on there. But we're also really excited about some other things that we've been doing in terms of discussions. So we had a new vision for behavioral health where we had Patrick Kennedy, Amy Kennedy, the head of SAMHSA, some really wonderful people to talk about what's the next level in behavioral health. Again, pushing that envelope. We had our Momentum Awards very recently where we were able to honor people who are doing what we expect to have done in AIHI. And one of those people was Taraji P. Henson, a very famous actress, many of you may know, as well as some local, notables who are really having the important conversations and doing the critical work. And we're extremely proud that we are going to be presenting our summit to address gun violence as a public health issue. So that's going to be on May 10th, and you see it here. We're going to have advertising on our website, but this goes to exactly what I've been speaking about with the prior slides, why it's important for us to have this conversation, how we should be talking about it differently. We have some really wonderful people, not only from the state of New Jersey, we have folks from New Orleans who are going to be joining us. We have someone from Illinois who's going to be joining us. It's going to be a really robust and exciting discussion, but important discussion so we can share ideas and knowledge about what's going on around the country in terms of gun violence and what it means to begin thinking about this as a public health issue. So Barb, I'm going to stop there. And if there are any questions, of course, about Ascenda, please drop them into the chat. But right now, I'm going to hand it over to Alex so she can walk us through this very important research that we were able to find. Thank you so much, Alex.
Yeah, thank you, Melissa. That was, it's really amazing to see all of the different programs that are so relevant to the research that we did. It'll be clear in a minute when I walk through the slides that Ascenda was such a natural partner for this topic. And it's awesome to know too about the upcoming event in May, because it's obviously directly related. So I'm going to go ahead and share my screens. For those of you who have joined our research webinars in the past, you know that I kind of run through the data, but please feel free to interrupt me if you have questions or thoughts. It's not meant to be like a rote presentation. Drop them into the chat, unmute yourself. This is really meant to be a discussion with all of us. And I think you'll find the data pretty compelling. And in particular, a lot of the nuances in the demographics, and it's clear there's not a one size fits all intervention. There's not a one size fits all concern or level of knowledge. And it's very, very nuanced in how we approach this complicated issue. And hopefully the data is helpful for you all, either internally or externally. I know it's been very helpful for Root Cause with our advocacy efforts and with how we communicate around particular issues. And then the last thing I'll just add is if you have thoughts about other research topics or related research topics or ways to explore this topic further, always feel free to reach out to us. We do these surveys on a monthly basis, and our goal is to make them helpful for our membership and helpful in our common agenda to, overall advance health equity. So please do reach out if you have any thoughts or comments. So with that, I will go ahead and share my screen. And like I said, and like Melissa and Barb have said, we were thrilled to partner with Ascenda on this research project. And, a lot of times these partnerships are selfishly very helpful for root cause, because the organizations that are working deeply on these issues are so knowledgeable on these topics and just help us make these surveys that much stronger. So this is a 10-question survey. It was released today, so you guys are like the very first people to be seeing the results, but all of the information can be found on the Root Cause website. It's gone through our social media channels. It is a free resource, so please use it. It is not meant to just live in the ethers of our website. If you need the data in a different format, reach out. It is meant to be used and promoted and seen by as many people as possible. So let's go ahead. Okay, so I'm going to walk through the slides, and if you have questions, just stop me. So at the bottom of each slide, just to orient you, is the question that we asked. It includes the sample size. So in some of the questions, the sample size is a little bit smaller because it was a filter question. So you'll see it change in a couple of questions. But you'll see at the bottom of the slide the question, and then sort of the headline at the top. So this first question is, when thinking about your community, how safe do you generally feel? And I think you'll see that in general, people feel pretty safe. So this is sort of like the overarching takeaway if you weren't to drill down on any of the nuance, right? So the importance comes in the following questions, but I want you to know that overall, people feel pretty safe, which we've come to learn is separate and apart from people's experiences with gun violence and day-to-day sort of comfort levels. Okay. So following each top line slide, we drill down into the demographics. We capture gender, we capture a little bit of race information, we capture age breakdowns, region, income, education, and whether you're a parent or a non-parent. And so if you see red in any of these columns, and the same format follows throughout, it's significantly different from the other component within that demographic. So for example, among those who feel very safe, whites feel significantly more safe than either Blacks or Hispanics, which I think is pretty telling. Hispanics feel significantly less safe. So again, if you're just looking at the top line information, your takeaway might be, oh, well, people feel safe going about their daily routines. If you drill down, it's very clear where some of that race nuance comes into play in this circumstance. Okay. So this next slide, this asks so this is a very small sample. So we want to caveat the findings for this question with a small sample size, but we did take those individuals who said that they felt very unsafe or somewhat unsafe. And we asked, why do you feel this way? Essentially, select your top 3 reasons. This represents the people, the first choice responses, essentially. So you see among the people who put gun violence in your neighborhood as a first choice or top concern, 15% of those who feel at least somewhat unsafe said gun violence in their neighborhood was the reason that they feel unsafe. 17% said car traffic. So it's fairly similar, fairly equal level of concern. And then 20% other types of violence in your neighborhood. That's obviously something worth exploring. Okay. There's not really significant demographic differences here, which I think is also interesting in and of itself, that of those who have some level of concern, it kind of cuts across. There's not a particular demographic that stands out. Okay, here's another question. How significant, and I think this is where it starts to get really interesting. How, on a scale of 1 to 10, how significant of an issue do you think gun violence is in the United States? And here you can see the gray. So 51% say it's very significant. 37% say somewhat significant. So there's only 12% of the population that says it's not at all significant, which I think if you're using this data for policy or advocacy purposes, like here it is, like people think this is an important issue. It's something to improve. Okay, and here's the breakdown. So for those who think it's a very significant issue, older adults tend to think it's more of a significant issue than younger adults. It's still high percentages, but it's higher, significantly higher among older adults. Okay, we asked about, do you hear or read more or less or the same amount about gun violence since COVID? And I know living in DC, there's been just so much more coverage around gun violence, even just in the last week in DC. And so I think this is an important slide in terms of people's resonance with the issue and how much of a priority it becomes. And so here you can see 40% say they read or hear about it more than before COVID. 32% say about the same. Only 16% say less. So you can see if you combine, 40% and the 32, you get about 3/4 saying that they hear about it the same or more. Okay, and for those who say they hear about it more, it's not surprisingly higher among higher income earners, college educated parents, and urban. This is a trend. Melissa and I have talked about this. Like we've seen these sub-demographics pull out for not just this survey, but like across so many surveys that we've done where you see this trend of like higher income, college educated parents, and urban. And it's just like this clump of a subgroup that tends to track along certain lines. And I think you'll see it again through this survey. All right, here's another really compelling slide. Have you or someone close to you been affected by gun violence? So you see this, like you see the pie and you're like, wow, most haven't. And then you look at this 24%, it's 1 in 4 people say that they have been or someone close to them has been affected by gun violence. To me, that's like staggering, like just a general survey of 1,000 adults, nationally representative, 1/4 of individuals have been affected by gun violence in some way. Okay, here's the breakdown. Again, I think this is a particularly important nuance where you see in that yes columns, that first column, 40% of Blacks, again, like staggering, 40% of Blacks say that themselves or someone close to them has been affected by gun violence. 32% of those under 45, 37% of parents, and 32% of urban. So, just right there, it's like, wow, right? Like nearly half, 40%, maybe you don't want to say it's nearly half, over 1/3 of Black Americans have said that they are someone they know has been affected by gun violence. If you look at the no column, again, pretty interesting, right? Like whites are significantly higher, 74% say no versus 57% of Blacks. Okay.
Alex, can I add something real quickly?
You bet.
So one of the things too, and I would love to get, other people's thoughts on this, as we were going through this really important information, and as a lot of us are going to be using it for advocacy, et cetera, and for messaging, one of the things that I'm going to hold myself accountable to is to not have this fall into a category of, oh, this affects others situation. So, it affects people, that don't look like me, or it affects people who are not in my socioeconomic realm, or it affects people who are not in the same neighborhood that I am. And I think the reason why that's important as we look at this data to really understand is for the reasons that I mentioned earlier, that there are larger economic, societal impacts, cost to the healthcare system, cost to the overall employment network, cost to communities, which then can impact taxes. I mean, people need to understand that there are some wider spread effects to this than just that, okay, that's, this is something that could impact others. So that's just one of the things I want to call out as we're looking at this, excuse me, because there are other, communities that are more impacted, or, groups that are more impacted, age cohorts, whichever. But this is definitely not a problem that affects someone else or others. This is really something that has a wider spread impact.
Yeah, thanks, Melissa.
That's an excellent point, Melissa. And you know, it's the root of what we're here to do, right? Is to show that these issues really do have such far-reaching effects. They're not isolated among one group or one neighborhood or one region. And what affects you affects me, affects him, her, and we have to understand that addressing these issues collectively is what ultimately gets us to health equity and a better, safer life for everyone. So it's yeah, I'm glad you called that out. Thanks.
Yeah, thank you. Okay, so then we get into kind of the questions around interventions and hopefulness in terms of direction that the country is going, and sort of hopefulness for yourself or your family. So this question actually asks individuals to rank from most important to least important the areas that need to be, and this is the most important part of the phrase, needs to be improved in order to reduce gun violence. So if you look at this and you just see law enforcement involvement, the finding is not more law enforcement involvement. The finding is that 34% of folks who filled out this survey said it was most important to improve law enforcement involvement, improve healthcare, 1 in 5, improve community education, improve strong leadership, etc. So there is a theme in 2 of these questions, this one being one of them, that law enforcement involvement, improving law enforcement involvement and relations with law enforcement is critical. I'm not saying that's the solution, but that's the finding or the perception and attitudes of people who filled out the survey. Okay. So when we look at this and we look at improves law enforcement involvement, you can see that older adults were significantly more likely to say this compared to younger adults. When we look at improving the healthcare system, we see that it's sort of the converse. Younger adults are more likely to say this than older adults. And then whites are also less likely to say this. Again, you can drill down and ask like why, right? Maybe it's because whites, just speculating, but like maybe it's because whites have better access to better healthcare, right? And so it's a less critical, direct need than compared to some other demographics. Okay. Here we ask, do you believe there are actions society can take to help prevent gun violence? And thankfully, I think this slide is very hopeful, right? 3/4 of Americans believe there are actions that we can take. Only 16% say they think there's nothing that can be done. And then we drill down and here you see a split with the education piece where you see 84% saying that they believe that there are actions that society could take, and 69% say of non-college educated saying that so there's a significant difference between those 2, and then the same holds true for the no, I don't think there's anything society can do. It's the converse. Okay, and then this asks if you believe that there's something that can be done, essentially. So it's like a filter from the previous question. How important are the following actions to help prevent gun violence? And here it was a scale from very important to not at all important. And you can see here this law enforcement theme kind of come up again. Improved relations between communities and law enforcement. 78% said it was very important. Local policies to create safer neighborhoods, opportunities to engage youth after school. I mean, the takeaway from this slide to me is like, there's not one thing that can or should be done. There's multiple things. I mean, even the striation between the very important, the lowest is better coordination among healthcare and social support systems, and 57% still said it was very important. So, you know, it's sort of twofold. One is like there's multiple needs, and 2 is this law enforcement theme came up twice as sort of the top piece needing improvement. Melissa.
Yeah, and this is really interesting because I think it speaks to when we're taking a public health approach and letting the data direct what needs to happen, it could differ by community, right? So it could differ by community, could differ by region, could differ by county. But everybody's understanding that there does need to be a mix of these elements for it to really work. Which one has to weigh more depending on where you are could differ, but they're all just as important.
Yeah, exactly. And so, it speaks to like the community's needs and understanding the community and what intervention or improvement, is most needed in a particular place. Okay, so here's the drill down of like various types of interventions. And it's interesting. I think look at mental health treatment, right? And females are much more likely to, or significantly more likely to say that mental health treatment is important to preventing gun violence than men. Same with interrupter programs, same with gun violence education. If you look at better paying jobs, I think that's also pretty interesting. So you can see Blacks are significantly more likely to say better paying jobs, or also Hispanics are more likely to say better paying jobs, parents, and then those who are affected by gun violence. So I think, these findings are certainly ripe for further exploration. I think, qualitative findings and focus groups are like really the way to kind of get to the root of like what this all means, right? But at a top line, I think it's very helpful for advocacy purposes to say, like, look at these disparities between people who are affected, what the needs are, and just the diverse set of solutions that are very like community oriented. Okay, and then finally, when considering the next 5 years, how hopeful do you feel about the well-being of yourself, your family, and the country? I think, it's nice to end on a hopeful slide where you see the majority of Americans feeling pretty hopeful about themselves, feeling pretty hopeful about their families, feeling significantly less hopeful about the country. And this would be an interesting data point, I think, to track over time through different administrations, through, periods of pandemic. But it's, it's very, and I don't know if this is a result of COVID or not, but, people's sort of insularity over the past couple of years have made them much more focused, right? Like on your home and your immediate like surroundings. And that might be some of what's being borne out in this data. And then lastly, the demographic breakdown. So you can see hopefulness is higher among higher income earners, it's higher among parents, same tracks for family and the country. And I think, that's another data point that's very telling from an advocacy perspective, is like, even when you look at how optimistic one is, it's distinct by income and other factors. So with that, we've just got one slide, just sort of as an FYI on demographic breakdown. It's posted on our website, and that's it. So I will stop sharing my slides, and we can open it up for any questions, thoughts, and comments, and see where their discussion goes. Thank you very much.
Thanks, Alex. Thanks, Melissa. Again, questions, comments, go ahead and put them in the chat. Feel free to unmute yourself. Would love to answer any questions that you have. While you're populating the chat, maybe just a couple of thoughts. Again, I think it's one of those things that just proves time and again how you really need to delve into the research to see what lies behind it, because you could, as Alex said at the beginning, have looked at this and thought, oh, this isn't so much of an issue. It is an issue. I think the numbing factor that so many have had to this epidemic going on in their neighborhoods is horrific, something that we need to really continue to address collectively. And as we've already said a couple times during this conversation, it's important to all of us, and it's on all of us, right? So for those of you who are members of the coalition, you have heard us talk about our Equity Legislation Monitor that we affectionately call the ELM. I would encourage you to take a look at that. Hannah Miller, who is our Senior Advisor for Advocacy, just gave a wave there, updates that regularly. If you've got some research or information that you feel would be relevant to post on there, it is certainly about key legislation in our 7 areas of priority, but it is also other resources that are out there. And so many of you are doing extraordinary work that we'd like to share that with others as well. I'd also like to encourage you, if you have not, thought about registering for the summit yet, which is this October 2nd, 3rd, and 4th in Minneapolis, to please do so. Madison Flores, who is our member relations manager, she'll be sending out the registration codes for members who, of course, receive complimentary registrations. Those of you who don't, we really work hard to make this a very affordable conference. And I really can't stress this enough, and you'll be reading this in our newsletter over the coming weeks and months. We pledge to you to make this a very safe conference. We know that the world is opening up. People are coming back. Last week, the mask mandate and planes went off, but we are requiring vaccinations. We will be masked. Everyone on this call has given so much of themselves over the last 2 years, 3 months, to keep those whom you all serve every single day lifted up, healthy, and getting as best of access as you can. We owe you the same, and I want you to know with confidence that that is our pledge for this summit. We have got some confirmations of keynote speakers. We had incredible submissions for the summit as well, for breakout and poster presentations. And I think you're going to be really impressed and anxious to see the full agenda, which we'll be releasing in a couple weeks. I'm able to share that the Attorney General for Minnesota, Keith Ellison, will be our keynote speaker on Monday morning. In his role, he was the chief prosecutor for Derek Chauvin. And I think his comments and his perspective and the message for all of us who are sharing this information today, again, we need to continue to come together and really work collectively. That's what the Root Cause Coalition is all about. That's why we are cross-sector. It isn't just one of us. It isn't just one sector whose shoulders all these issues rest. And so, Melissa, I thank you just tremendously for the work that you're doing. And Abby has a question there, Alex. Or is it a comment? I'm sorry. I'm
It's
talking.
a comment. Yeah, she was just saying how she'll use this data to line with her other data. Yeah.
Wonderful. And yeah, like Alex said, this is going to be on our website. If you have any questions, the email for both Alex and Melissa is at the end of the slide presentation. But we're here to work with you, serve you. I always say it's a two-way street, and that's our commitment to you. I would just maybe ask Alex, Melissa, any other questions? And then also Hannah and or Madison, if there's anything you'd like to add.
I'll just add really briefly that in addition to this survey, we have next month, we'll be releasing a survey on maternal health and attitudes around maternal health, sort of experiences and perceptions and priorities related to maternal health. So that should be a really, really interesting set of findings, and we'll be releasing that at the end of May. So stay tuned for that. And like I said at the outset, if you have thoughts on other research topics, please do always feel free to reach out. Hopefully you found this information helpful and that you have utility in using it, because that's the whole point. So Melissa, any other thoughts?
Yeah, one thing I'd add first, I just want to thank you all very much for partnering with us to get this important research out there. And one of the important points, one of the more important points that kind of came out of this to me was to realize that we are going to have to be very thoughtful and strategic about the communications regarding gun violence. It's very clear when you look at this research that different people are looking at this different ways, right? It's the whole elephant proverb, depending on what part you touch, that's the part that's real to you. Right. And so I think that with gun violence, it's the same thing. So having a generic message, having a generic approach, having a generic call to advocacy is not going to work, but being a lot more targeted and strategic and speaking to people where they are, I think will help to move the envelope, because move the needle, because there's no way that we can continue on the trajectory we're on right now, even though numbers overall are much higher, and you'll have people say, well, the rates are actually lower. Okay, well, yeah, that's true because the numbers are bigger. However, there are communities that are being devastated, and this, I don't think that we are going to see it continue on that path for longer. It's going to eventually kind of catch up with itself. So I think the messaging and how we message and how we engage people to advocacy is going to need to be a lot more nuanced probably than it has been.
Great, thank you. Hannah, anything to add on the ELM or other areas of advocacy?
No, I think we've covered it all. Like Barb said, I'm continually updating it. And if you have any resources on any of our focus areas that you'd like us to share that your organization has done, please feel free to send them along to me, and I can get them up there to get some more eyes on all the great work that I know our members and partners are doing. And thanks everyone for joining us. And thanks to Melissa for being awesome as always. We are very lucky to have you.
Yeah.
Absolutely.
Thank you, everyone. Any other final comments? Thanks, Bill, for the link.
Yeah, I was just going to point out, Bill had inserted a link to an article on addressing gun violence in there. So please check that out. Madison, I've acknowledged you. Let me see if you have anything to add, any updates to provide anyone while we got a captive audience this morning.
No, I think everything's been covered. And I do just want to echo Hannah's comments as well and say that, Melissa, we're so thankful to have this opportunity with you and to work with you. I'm really excited to see, the continued work that we can do together. But I want to thank everybody else as well for joining us this morning. A recording of this webinar will be available up on our website very shortly after. So if there's any information that you missed or wanted to revisit, it will be there shortly today. But yeah, again, feel free to reach out to any member of the coalition if you have any questions.
Thanks, Madison. And thank you, Joan, for your comment in there as well. Again, we just ask that you stay safe. The work you do is phenomenal. And any questions on anything, know that we're here to support you in your daily work as well. So with that, we'll let everyone go and hope to see everyone soon, whether on Zoom or later this fall. Take care.
Thanks.